Hello and welcome to the New to Medicare Your Self-Service Toolkit webinar. My name is Bailey Lawson. I am one of the specialists on the Provider and Outreach Education team, or PO team, at WPS, and I will be your speaker today. Assisting me today is my friend and colleague, Mary Muko. She'll be monitoring the chat and helping me during the webinar. Today, we are going to be going over the tools that you have at your disposal in your toolkit. The objective here is that you're aware of these said tools. We are going to be doing that by talking about why self-service tools are important, what tools are available, and where to access them. We'll do that by looking at things like the WPS website and the CMS website. Now remember, this is a new to Medicare event, meaning this is geared toward those who are in fact new to Medicare. So those with 6 months or less of experience in the realm of Medicare. This can also be for someone who is just looking for a review, but I say all of this to make sure that you're aware that this will be a very high-level overview of the tools that are available. I won't be going into a great deal of detail simply because I don't want to confuse anyone. With that being said, I will also only be answering questions that pertain to the topic and will not be straying away from the topic at hand. Medicare can be super confusing, and this is just my best effort to make it less confusing to those who are new, and that's why we're going to stay on topic today. Okay, so why should you use these tools that are in your toolbox? Well, it is information and services at your fingertips. This is information and resources on your own terms, meaning you don't have to call in and ask questions. You don't have to adhere to business hours. These are things that can help you and give you the right answers then and there. There is also a lot more flexibility in these options. While I understand sometimes the help you need is super specific and situational and complex, and you'll need to speak to an actual person, a lot of the time, the questions that you do have, the answers are in these resources. It is also a huge time saver to use these tools because there aren't those wait times that you would experience when needing to speak to a human being, and it could ultimately save you from getting a headache. So really, I'm just saving lives out here with this information. On the flip side, by using these self-service tools, you're helping your future self out and others around you out. And what I mean by that is if you're using the tools instead of calling customer service for a non-complex question, such as what is my claim status, which can be found within a self-service tool, that then frees up support staff to answer those complex questions. That is not to say that not all questions are important, because all of your questions are important and we want them answered. That is just to say that there is a domino effect, and that if you use the tools for things that can be found in those self-service tools, it makes for a smoother ride for everyone. The support staff are able to answer complex questions if you have them. You are able to get those complex questions answered quicker, and you are able to get those non-complex questions answered quicker as well by not having to call in for and have those wait times. Does that make sense? Kind of dovetailing off of that little rant, something that you may not know is that CMS actually prohibits our customer service staff from providing answers that are available on a self-service tool. So customer service calls really are for complex questions. And I'm going to have Mary add the resource for you where it kind of details these things out. This resource is the Medicare Administrative Contractor MAC Beneficiary and Provider Communications Manual, and you'll find specifically what I'm talking about at Chapter 6, Provider Customer Service Program, Section 30.3.1, and it's titled inquiry triage process. So you can kind of get a little bit of a better understanding on calling into customer service. So we've been talking about tools, we've been talking about toolboxes and all of those things. So let's get into what all of that means. What tools do you have? Well, you have the CMS website, the Comprehensive Error Rate Testing or CERT provider website, the Social Security Administration website, the Code of Federal Regulations website, and of course, the WPS website. And we'll go over each of these in more detail as we move through, but these are just the tip of the iceberg. You have so much at your disposal, and I want you to be able to utilize those. So this is quite a large toolbox because looky here, we have more tools to take a look at. We have direct data entry or DBE, email communications such as the e-news, which is current news from CMS and WPS delivered right to your mailbox. And you've got the interactive voice response or IVR system and remittance advice or RA. So let's crack the lid open on this toolbox, shall we? And we're going to dive into the CMS website and kind of what's available on there. So cms.gov is the official provider website. This contains a lot of tools for you. As a brief overview, we have the internet-only manuals. You'll hear it referred to as IOM, which are day-to-day operating instructions, a really important one of Medicare rules and guidance, and education for you, and of course, contact information. Starting off with the IOM Internet-Only Manual resource. The Internet-Only Manuals, IOMs, are a replica of the agency's official record copy. They are CMS's program issuances, day-to-day operating instructions, policies, and procedures that are based on statuses, regulations, guidelines, models, and directives. The CMS program components, providers, contractors, Medicare Advantage organizations, and state service agencies all use the IOM's internet-only manuals to administer CMS programs. They are also a good source of Medicare information for the general public. I have this written out for you to find the IOMs, the directions on how to get to the internet-only manuals, but I will also help you find that and go over how to find it step by step in the live navigation portion. So I wanted you to have it in writing, so in case you needed to go back, you have the steps there written out for you. Next, we have the Medicare Coverage Database, or the MCD, you'll hear it referred to as. On the Medicare Coverage Database, MCD, you can use CPT or HCPCS codes to search for documents. Results will return billing and coding articles or other documents. So you find information on the national coverage determinations, NCDs, and the local coverage determinations, LCDs. Again, we'll go over this in the live navigation portion, but I have the steps on where to find the Medicare coverage database in there. I also just have it directly linked if you just click on Medicare coverage database. But again, if you for some reason don't have this handout handy and you can't remember how to get there, I have the steps written out for you. There is also, of course, an entire section that contains information regarding Medicare. This is something that will stick out to those who are very new to Medicare, to the point where they don't even know, and new to Medicare as in they don't even know what claim form they'll be using. So this is something that is it's going to stand out to those who are that new, because it has a ton of information. And again, I'll show you again when we go through the live navigation, but this section will hold information on traditional Medicare or original Medicare. You may have heard it both ways. You may have heard it one or the other, but traditional and original Medicare are the same thing. It has information on Medicare Advantage plan information. Keep in mind, each plan has its own rules. So if you have plan specific questions, you'll need to contact the plan provider. That's for Medicare Advantage. And there's also information in that covers prescription drug plan, or PDP. So again, if you're very new to Medicare, this has a lot of information on the breakdowns of the parts of Medicare and a lot of details on those. So we'll go over that. I'll show you in the live navigation. Oops. Another great resource, especially again for those who are new to Medicare, are the educational resources. The first one is the Medicare Learning Network, or MLN. This has an abundance of information, and one that is the biggest of note are the web-based training. There are also resources on publications, articles, newsletters, and provider compliance. And again, I'll show you this all when we go through the live navigation, but I want you to have the information now. This page provides the list of contact phone numbers and web links to help you find answers to your Medicare questions or program issues. Information in this page, the contacts cannot respond to individual Medicare concerns, because remember how we talked earlier, customer service can only answer those complex questions. Some contacts that are available to this information or on this resource are information to the central office, regional office, as well as contact information for those who have Medicare. So this would be good contact information for you to give to your patients who have questions, or refer them to this web page specifically, however you want to do it. But there's also information on there for people who have Medicare themselves. So we have gone over the website for resources and guides for providers. Now let's talk about the patient website. If you've been to any of my other new to Medicare events, you'll see that I always recommend this resource. It may be for the patient, but there is a wealth of information for you as the provider and someone who is new to Medicare. Not only for you to be able to provide guidance to your patients, but also to help give you breakdowns at a very high level. When learning Medicare, it can be confusing, and this is a resource that gives that information in a very basic way. It covers things from benefits and coverage. You can get information on the parts of Medicare and the different things that those parts cover. There's a secure section for patients where they can get a summary of their current coverage, add their drugs and pharmacies, and use their saved drug and pharmacies to compare plan costs. This provides also the Medicare NU guide, and that's a huge resource as well. I recommend that along with the patient website during every single one of my new to Medicare webinars, because it is such a great resource, and it's a huge resource with all of the information compiled into one place for your reading pleasure. And again, I'll show you that. This is also something good to get familiar with because it would make it easier to direct your patients who have questions to a particular resource to answer those questions. Moving on to the WPS website. Some information to make note of. If you don't already know, we at WPS are a Medicare Administrative Contractor, or a MAC. A Medicare Administrative Contractor, a MAC, is a private healthcare insurer that has been awarded a geographic jurisdiction to process Medicare Part A and Part B medical claims or durable medical equipment, DME, claims for Medicare fee-for-service beneficiaries. CMS relies on a network of MACs, Medicare Administrative Contractors, to serve as the primary operational contact between the medical fee-for-service, Medicare, not medical, Medicare fee-for-service program and the healthcare providers enrolled in that program. MACs are multi-state, regional contractors responsible for administering both Medicare Part A and Medicare Part B claims. MACs perform many activities, including process Medicare fee-for-service claims, enroll providers in the Medicare fee-for-service program, handle redetermination requests on the first stage appeals process, respond to provider inquiries, educate providers about Medicare fee-for-service billing requirements, review medical records for selected claims, coordinate with CMS and fee-for-service contractors. So that's a little bit about MACs, if you didn't already know. And the jurisdiction that we at WPS cover, jurisdictions, I should say, are J5, which is Iowa, Kansas, Missouri, and Nebraska, and J8, which is Indiana and Michigan. And in terms of which claim forms go where, Part A will use UB04 and 837I, and Part B will use 1500, claim form 1500, and 837P. Okay, so diving deeper into the WPS website, there is a public section, and this is exactly as it sounds. Anyone who Googles WPSGHA.com can see what is on the website. This is all the resources we have out there for you. You can search information by topic. You can go straight to looking at all of the tools, and you can see all of the education opportunities we have. We'll get into all of those things when we have the live navigation as well. Oops. The secure section is a little different. This is also exactly as it sounds. It is secure. This is the Secure Net Access Portal, or the SNAP portal. This is something that access is granted based on need. So for me personally, I have no need for it because I'm not checking eligibility of patients, I'm not checking claim statuses, I'm not a provider enrolled in Medicare and things like that. So I do not get access. But you as a provider get the access because you will be doing all of those things and you have a need for those things. Another thing with the secure section is you can send secure messages. This means that your messages are protected, so you can include personally identifiable information, or PII, or protected health information, or PHI. Whereas if you're emailing the education mailbox, that wps.gha.education@wpsic.com email, that is not secure. So you should not include those identifiable information tidbits. The only way for it to be secure is if you log into that secure section in the portal, the SNAP portal. So I just wanted to make note of that. And again, we'll go through everything once we get on there, but go. I have added these links into your handout materials so that you have these great resources available to you. All of the resources go into detail about each of these things: direct data entry, the interactive voice response system, and the SNAP portal, which we just talked about. And again, we'll go into more detail during the live navigation portion. Now going into the other websites that will be helpful to you. You may hear the acronym CERT, which is Comprehensive Error Rate Testing. The CERT website is designed to provide Medicare providers, suppliers, and contractors with information about the CERT program and to facilitate coordination, collaboration, and communications between all stakeholders. This web page covers a brief description about the CERT program and the functions of the two CERT contractors, the review contractor and the statistical contractor. It also has how to submit records, samples of request letters, and documentation checklists. So we also have the Social Security Administration website, and I have specifically highlighted here the Social Security Act, which was the law that created Medicare. Title 18 is the information for health insurance for the aged and disabled, which is Medicare. I have included the specific sections of 1861, which is the definitions and services and institutions, which will be very helpful to you in your new to Medicare journey, and section 1862, which covers the exclusions from coverage and Medicare as a secondary payer. So this is a great reference to go back to because it is the law of Medicare. So that's why I added that. And then lastly, we have the Code of Federal Regulations, or CFR. It's the official legal print publication containing the codification of the general and permanent rules published in the Federal Register by the departments and agencies of the federal government. The Electronic Code of Federal Regulations, ECFR, little e, big CFR, is a continuously updated online version of the CFR. It is not an official legal edition of the CFR. It is a web version of the Code of Federal Regulations, CFR. I've been saying that a lot. It is updated daily to better reflect its current status. The ECFR, the Electronic Code of Federal Regulations, is an editorial compilation of CFR material and amendments published in the Daily Federal Register. I have Title 42 highlighted, and what I want to point out is subchapter B. This talks about Medicare, and again, during the live navigation, we will go over that. So now we're going to enter our live navigation. Give me just a second to pull over all of my tabbies. If I can grab it here, there's a ton of stuff in the way. There we go. Okie dokie. All right, Mary, can you see the CMS website?
Yes, I can.
Okay, thank you. All right, so like I said, we're going to go over how to find things. So the first thing that I want to show you how to locate, so you're going to go to cms.gov. You can follow along with me. You can just watch and write notes if you'd like. I already have this in your handout materials, but I'm going to show you anyhow. So we're at cms.gov, and then we're going to go to this Medicare tab. Once you go down there, you'll find regulations and guidance. Click on that. And then once you go to regulations and guidance, we've got manuals right here at the top. Click on that. Oops. And then see the manuals here? We've got internet only manuals. So this is a whole list. You can filter, you can search this way and type in. Mary herself is a searcher, so she would be typing in, you know, la 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 la, whatever you want to type in. And then we've got this show entries. It's the amount of entries you can have on that page. So I'm just going to click all just so you can see. There are 25 of them. And then it kind of gives you a blurb about what IOMs, internet only manuals, are. And then it breaks it down. So we've got a ton of information out here. Well, CMS has a ton of information out here for you. And you can look at these things, and you'll see a lot of times if you come to a WPS webinar, a lot of the time you'll see resources that are linked in the handouts or given to you in chats will include an IOM because they have so much information. So Medicare Benefit Policy Manual is a great one for those new to Medicare. So I'm just going to click into that. And actually, let's do Medicare Claims Processing Manual. So you click into that, and then it gives you all of the chapters that you'll want to look at, or broken down by chapters to see what you would want to look at. Sorry if this is too fast of a scroll. Okie dokie, I'm just trying to scroll slowly to the top here. So I'm just going to click into this general billing requirements just to give you an idea of what it looks like. So we've got what it is, the chapter it is, and the table of contents first. So let's say we're going down, scrolling down, and we see something we want to look at. Provider participation. Now you've got it marked. You'll just go to section 30, which there's a lot of scrolling, so I apologize. I'll scroll down here real quick. So you can see it's marked off by 1, 2.1.1. So it's marked off, so you'll want to look at the bolded 2.1, whatever matches what you were looking, 2.1.2, whatever you're looking for. I picked something really far down, so I'm not going to scroll super far down. Remittance advices 2.3. So just for to show you how to find things within. So see how that was chapter 1, and then we were in chapter 2. So then it goes, and you can also, I don't know why it wasn't doing that before for me, but if you find something, why is it not doing it now? If you find something you want to look at, okay, I'm just going to click. See how it's turned from a cursor? See the cursor? It's an arrow to a finger. When you do that, boom, it takes you to that section. So instead of scrolling, mine wasn't doing that at first for some reason, so I apologize, but it takes you right to where you were looking at. So that is IOM. Now we're going to do locating the Medicare coverage database. So again, you can go into Medicare. You can also just search, which for this specific resource, I find searching to be the easiest, but I'm going to show you how to get there otherwise. And you go to Medicare, you go to hold on, I lost my train of thought. Coverage, there we go. I had to remember what I was trying to find. Medicare to Medicare coverage database, however you want to pronounce it. And then here we have it. So you'll search, we'll do, this is my psychiatry. And then this is what will come up. Hopefully I spelled that right. I get nervous typing in front of an audience. But you'll have these articles, LCDs or NCDs that come up. And we'll just click into this one. And this is an LCD reference article that when you click into it, you have all of this information. So that's kind of how that works. And then it's got this table of contents within that LCD that you had just clicked into. And something I do want to make note of is CMS is the place where LCDs and NCDs will be available in its entirety. We on the WPS website will not house them in its entirety. It'll take you right over to CMS. If you're searching, doing the lookup tool, it'll take you right to CMS anyway. So I just want you to be cognizant of that, is that you'll end up on CMS's Medicare coverage database, even if you start the search over on WPS. Okay, so now we're going to go back to cms.gov and locating just the Medicare information. So Medicare dropdown, and then you will go to any of these really, because this is the Medicare information. So we're going to go, let's see, coverage determination process. Let's see. Here's a bunch of information and resources. So there's nothing crazy to finding the Medicare information. It's just really, this is all Medicare. If you were looking for Medicaid, you'd go here. But we're looking here. So let's see, payment. There's just fee schedules. I know a lot of people have questions about fee schedules. So anywho, that's where all the Medicare information is housed on the CMS website. Silly, but that's where it is, in case you didn't know. Okay. Next, we have the MLN. Oops, go away. Go away. There we go. I'm just going to go back to the home page. You don't have to, but I'm going to for the sake of when you first come into the website. So for finding the MLN, the Medicare Learning Network, you're going to go over to this different tab, which is Training and Education. Then you're going to have it, you see it, it's listed right there, Medicare Learning Network. And then you've got this, it broken down by categories. So we're going to go to Resources and Training. And this will bring up the one that I want to point out that is the most useful is the web-based training. You can see I've clicked on it personally, but we've got publications and multimedia. We've got the MLN Matters articles. We've got the newsletter here. We've got provider compliance, and then the CERT Outreach and Education Task Force. I'm going to click into web-based training just so you can see. And then it shows you the available courses. And there's the claim forms. If you need information on the claim forms, a ton of great resources for you out here. Okay, and now locating the contacts. We're going to go up here, and again, I'm just starting at the home page, just start fresh. And anytime you need to go back to the home page, you can click cms.gov up here in the corner, but we're going to go to About CMS, and then we're going to go to Contact Us. And then we click on that See More. Oh wait, did I lose it? Nope. click on Contact Us. And then under Contact Us, the one we're going to click into is the See More under this Contact CMS right here. And then it gives you a bunch of information. So contact information, like I said, for people with Medicare. So if you're helping a patient out and you don't know the answer to the question, or, you know, whatever the case may be, you can direct them here. You can jot these down just to have in your office, so you can write it down on a sticky note and give it to them, whatever the case may be. You can also see that patient website I put in the handout materials was linked there as well. And just because this is marketed as contact information for people, or listed, I should say, for people with Medicare, like I said, this resource is really helpful. These resources are very helpful regardless of who they're targeted at. But as a provider, this is great information to have anyway, because it's also language that you can use when speaking to your patient. So anywho, that's Medicaid, so we're not going to talk about that. Contact information for the CMS regional offices, and then you'll just click the hyperlink, and then you'll figure out from there where you want to contact. So we've got, you know, central office, Baltimore, and so on and so forth. Anyway, so that's that. Next, we're going to move, I actually want to show you cms.gov right now. I forgot to pull the, not .gov, not CMS, Medicare.gov. Silly me, that's where. So I forgot to pull that tab up. So before I forget, I just want to show you the patient website. Again, if you've been to any of my events, you would have seen this before, but I just feel it's so important. A lot of the information when I was learning Medicare, I got from Medicare.gov, just because it's great and has a lot of information for you. So if you want to learn the basics, get started with Medicare, Medicare costs, your Medicare rights. It also helps to understand from the patient's point of view, so you can advocate for them if you need to, and, you know, not steer them in the wrong direction with advice, whatever the case may be. So let's see. This, oh, you know what? This is where I wanted to go. So if you click on health and drug plans, you can learn about the different Medicare coverage. So Medicare Advantage, a lot of people have questions about Medicare Advantage, and this gives you a lot of information. Learn about the plan types, understand the plan costs. You can even find out how to join a plan so you can help your patients as well, if that's what you'd like. Then we've got it listed out here, what Part A is and what Part B is. There is information about Medicare Part A and B. Providers, that I don't think that would really pertain to you. The search bar, let's see. So what Part A covers. And then it goes into, you can click into, and it gives you information, what everything costs and the breakdown of everything, what the facilities are, all of that kind of information. So it really is a great resource, even though it's for patients, because if you didn't know about this, would you have known that this is available to you? So I always make sure I tell everyone about this. So it looks like, according to this little pathway, you go to provider services, and then what original Medicare covers. So that's how you would find it without having to search it. You would go to provider services, learn what original Medicare covers, and then look at this. Look at all this information. It's great. It's great because it's also for patients. So the reading level is lower, so it's easier to comprehend. In my opinion, that is the case. Anywho, so that's the Medicare.gov, a little bit in more detail. And then there's also a great resource on this as well, and I mentioned it in the presentation, in the handout when I was talking about everything. So Medicare and You, that's that guide I was telling you about where it's kind of your one-stop shop. So you'll go here and then you'll click download the PDF at the bottom right there. And then it's all this information for you. It's technically for patients, but again, I think that it's great. What's new and important? Signing up for Medicare, original Medicare. So again, see how the pointer, the mouse cursor, that's the word, cursor, it's the little arrow, and then you go over here and it becomes a finger, a hand, click it, and it drops down to what you were just looking at. And then there's more links to more information. So if it's a different color, it'll take you out there. And I think this is a great resource as well when learning. And I show this because new to Medicare, that's very important. All right, moving on to the WPS website. So we've got, I'm in jurisdiction B right now, and I will show you to change your jurisdiction. If you didn't know, you can just click through here. And the highlighted green is where you are, but I'm going to keep in jurisdiction B simply because that's what most people who registered are in, but I will show you differences. So in the topic center, and I want to show you this because it breaks it down by category, topic, because it's a topic center, duh. And I'm going to go into appeals really quickly just to kind of give you a breakdown of what the topic center holds. So I'm not going to go into each individual topic, just what the topic center holds, if that makes sense. So this top green bar, you'll have guides and resources that you can click on. You'll have news and updates that you can click on, and it'll just show it right there if there is any. And then FAQs, which if you do have a question, remember customer service has, it shows customer service answers complex question. So this, if you have questions about this topic, is a great place to look for an answer to your question because it may be here, and these are, it's those time savers we were talking about. And then we've got forms that you can download. So that's what the topic center looks like. If there is a self-service tool, there will be one right here. There is contact information here in case you need it. And then there is here, these are quick links. So if you have a question on how to appeal a claim determination, you can click here and it goes right to the article. And it gives you the calculator again and some other hyperlinks. If it's a dark blue, that's taking you to an external site, which is the CMS site. And it just gives you all of this information, how to submit one, all of that. And then again, just some hyperlinks. I'll go back. You can sort them by topic, specialty, or go A through Z, and then these topics will change. I'm going to keep it by topic because I like it best that way, but then you click the drop down, and this is just under claim denial. This is a resource that we have for you out there, and that's what every single topic will look like. And if you want to switch between topics, you can go here. Claims may be a good one to look at. So we've got a 90-day period for major surgeries calculator, an additional document request calculator, end stage renal disease coordination period calculator, and a reopening calculator. So you've got some self-service tools here, and then some more information to look at. So I just wanted to show you each of those things. The next thing I want to show you, here are some tools for you. So we'll go to all tools because they're not listed. Some great information for you, an acronym list. If you're new to Medicare, you may not know all of the acronyms and they may be confusing to you because one acronym in real life could mean, or I guess I shouldn't say real life, but let's say texting is different from a Medicare acronym. So here we have acronym list. Here's another tool, the CERT claim lookup tool. I'll click into that and you just enter the number, you search, and this is the key to telling you what each thing means. So no error is a check mark. There's an error, there's a red circle with an exclamation point. And if it's still in process, it's the blue circle with the ellipses. So this is a great resource for CERT claim, the comprehensive error rate. I'm blanking on what T means right now, but the CERT claim lookup tool. Testing, error rate testing, that's what it stands for. Next, we have the direct data entry electronic access request. And again, it's just more information that you submit, and it gives you a blurb on how to use this. Direct data entry submitter ID request, enrollment application status inquiry tool. This all forms, we looked at that. There was a tab when you're in each topic. There's a tab where you can go to the forms. This is just a compiled list of all of those. This is the portal user manual, which I have linked in the handout materials, but I'm going to go click into it anyway. This is a great resource for you to get your questions answered. So for example, if you're having trouble just knowing anything about the portal, like what it is, you got a portal overview. Then going into, more, so this is again just within the portal. So if you're a disabled user, what to do, your profile, how to change your password, multi-factor authentication, change your security questions, disable my account, all of those things, more technical stuff here. And then, there's also things like your eligibility check. So you click this and it gives you information on the eligibility check, how to do it. It gives you these great graphics as you go. So it really helps you to not be lost within that. Let's see, if you want to check a claim status, this gives you information on how to check a claim status. And again, I can't go into the portal because I don't have a need. Otherwise, I would show you these things within the portal, but because I can't, I'm going to show you the resources you can use. So there's those. And then I'm going to go slide up here. And then the next thing I want to show you is the DDE manual. And you can find that in the quick links, but I believe you can also find it in tools. But I'm just going to click this. And I just want to make note, if you look here, this triangle, this green thing right here, it comes up because DDE is for Part A. Jurisdiction A, I should say, Part A, but yeah, Part A. So I'm going to click over and see how that goes away. So you download this, and then it's instructions for using and navigating features in the DDE system. So if you're having trouble with that, if you have questions about that, there is a manual for you. Let me see. Let's see. We've got LCD and article lookup tool. If you remember, if you type that in, we did this on CMS, so it would look a little different than what it does on the CMS. But again, you click into it, it takes you to CMS, and then you'll see that there. Prior auth request search, you put the information in here as well for that, and then it gives you a blurb on the prior auth, what the prior auth request search is. I'm trying to think of what else.
Bailey, I placed something into the chat that I'd like you to show. It's based on something that you've already demonstrated. And if you've already shown it today, forgive me. When I'm watching the chat box, sometimes I have one ear open while I'm typing. At the top of a page, at the top of our web pages, could you show the, yes, right there, the message bubble?
Of course.
Bailey showed you just a little bit earlier the CERT claim lookup tool, and that's a fantastic tool. It tells you, you know, the findings for a CERT review. You have to enter in your CERT identification number, and that number is on that barcoded sheet you receive when you receive a request for records from the CERT contractor. But if you go to that bubble up top and go ahead and click on that, Bailey, if you would please. I want to show you that screen alert that is showing tells you that currently, for whatever reason, the claim lookup tool is not working. If you click on that box, it tells you that we're diligently looking at finding resolution to this problem. But I did want you to know that the system status and alerts will often save you a phone call to the call center, so that might be a great place to look if you notice an error. And certainly if you notice something that you don't see out here, give us a call and we'll look into it for you. So thanks, Bailey, for showing me that, or showing everyone that.
Yeah, and thanks for pointing that out, Mary. And something I want to point out within the system status alerts is, if you notice this is FIS claims processing, that's because we're in Part A. But if you watch when we switch over to Part B, it'll change to MCS. So although these stay the same, some of these will be different. So just make sure you're being cognizant of what part you're in when looking at that information. And I can show you other ways to get to it, but the easiest way to get to it is this little ellipses with the bubble. And then we've also got this ribbon down here that you can look at as well. And then you saw the little bubble, it's had 5 up there. That shows you how many notifications are. Now that there's no notifications, you'll see it's blank. Something else I do want to talk about is the IVR operating guide. So this is, there's a difference between Part A and Part B when you're in the IVR operating guide, but the guide, I can't find it right now because we are short on time, so I'm getting a little stressed, but I wanted to show you this. And it does differ between Part A and Part B when you are in the operating guide. Is it this one? It is linked in there for you anyway, but again, be cognizant of the Part A versus Part B, but the IVR operating guide is of great resources for you as well. So I just wanted to show you those, and then I'm going to quickly show you the other things that I said I was going to go through in the live demonstration, just as an overview. So this is the CERT hub, C3 hub. It gives you all the information right here about CERT, some record search. I can't go into it right now, but it gives you claim status search, you know, all the information. This is what it looks like. I have it linked for you, and it gives you some breakdowns of, you know, a quick guide, if you will. Next, we have that Social Security Act that I was telling you about, Title 18, and this is the insurance for the aged and disabled. This is the table of contents. The ones that I wanted to make note of were the ones that I had listed in there. Sorry for the scrolling. 18, where did it go? 1861, definitions of services. So you'll just click that, and then it'll take you to that section where you can read all about it. Exclusions from coverage and Medicare as a secondary payer. You can look through any of these. I'm not limiting you to these 2 because this is all obviously about Medicare, but these are the ones I wanted to highlight for those who are into Medicare. And then the last thing is the Code of Federal Regulations. If you remember, I said little e, big CFR, that's listed right here. You can see it right there. And it looks like this. It's broken down by titles, but the one I wanted to show you, so you don't have to scroll through, is Title 42. And then you'll go down, and under subchapter B is the Medicare program. So you'd click in there, and then you'd have all that information. And again, subchapter B, of course, has parts, and you can look through this way, hospital insurance benefits and stuff like that. So great resource for you as well. I know we're running short on time, and I apologize for that. Apparently, I'm a yapper today. So we'll just go back to the PowerPoint. And I see Mary has been very active in the chat. I don't think there's any unanswered questions, but in the interest of time, if there is a question in the chat that is related to the topic, I will email you the answer to that, but I don't believe there's any questions in the chat. So we'll go through this. Yep, and I see Mary said there are no unanswered questions in the chat. Thank you for being so active in the chat, Mary. So in a few minutes, moving on, in a few minutes, you will receive an email with the subject, "Thank you for attending." Don't delete this without reading it. This email will contain your certificate of achievement. The email it won't have an attachment of a certificate. It'll be under the topic line certificate, and it'll have everything you need, the contact hours, your name, everything you need for continuing education unit CEUs. If you don't see it, make sure to add the WebEx email address to your safe sender list. And if you called from a phone, please pay attention to this. You will receive a different email. It'll say, "Sorry, we missed you." This is because you didn't register with your phone number. So WebEx does not realize you've attended because it's looking for your email. It's not a problem. Just email that email that Mary will have put in the chat for you, wps.ga.education@wpsic.com, and put the webinar's name and date as the subject, and just let them know that you called in, what number you called in from, and we can verify attendance that way and get your certificate to you that way. If you think of any questions or additional questions, even after the event is complete, just send in an email. You'll have 7 days to submit them. Send them to that same email, the education mailbox that Mary has also put in the chat again, and just put "New to Medicare Self-Service Toolkit" in the subject line, the title of this webinar. That just lets them know who it needs to go to, which is me. And bear in mind, all claim-specific questions will need to go to customer service. We just don't have access to the information that we need to be able to answer those questions, so those will all need to go to customer service. If you could, please take a few minutes now to complete a survey. Tell us what you liked, what you didn't like, what we could do better, and suggest topics for future education. It doesn't have to be specific to Medicare. If you think of something like what we did today with tools and resources, if you'd like something more detailed on something you saw today that you think would be beneficial to you, we want to know that. Your feedback really is invaluable to us, and ensuring education that is timely and effective. Keyword effective. We want you to feel it's effective. So there are different options to take that survey depending on your preference and what's easiest for you. You can use that link in the chat that Mary put in there. You can also, when you close out of the webinar, it'll have a pop-up and it'll look like what you see here, the external site with the exclamation mark and the triangle. It's nothing malicious. It's just letting you know it's taking you to the external site, and that is the CMS page for the survey. It's not malicious anything again, so it's just alerting you it's taking you to another site. It just takes a couple of minutes, and it would mean so much to me if you could fill out that survey, and thank you in advance if you do. And I know we ran over by a couple of minutes, and I do apologize for that, but on behalf of myself, Mary, and Provider Outreach and Education, thank you for your participation. We look forward to your survey comments and hope to have you join us for future events. You may now disconnect.